Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Sharon Sinkler. Thank you, Sharon, and thanks to everyone who is joining us to learn about the latest local developments. I'd like to start off today by saying thank you. Thank you to our residents, our businesses, and our schools for understanding that the reinstatement of the mask requirement last week was a necessary and immediate step we needed to take to protect our community and get us through this surge. Our local situation remains critical, but our collective actions can help change the course of this pandemic. We're now averaging about 125 new cases per day, but the speed at which they're increasing has slowed down a bit. The increase in positivity rate has also slowed, but is still high at just below 10%, meaning the Delta variant continues to be widespread in Lancaster County. Our Lincoln hospitals are still strained. Currently, 76 COVID-19 patients are hospitalized. Sadly, several more COVID-19 deaths occurred over the last week, increasing the total from August from 18 to 27. Now let's take a look at the latest local information. The chart you're looking at now shows the 7-day rolling average of new daily cases. That color of the bars represents the color of the COVID risk dial for that date. The 7-day average has continued to increase, but the pace has slowed. Cases are doubling about every 3 weeks now. Over the past week, the 7-day rolling average leveled off to about 125 cases per day. For the cases to hold steady and then go down, we must remain vigilant in our vaccination, masking, and other prevention efforts. This past week, the number of COVID-19 tests conducted increased from around 8,200 to almost 11,000. This is the 10th week in a row that testing has increased in our community. The number of COVID-19 patients hospitalized locally continues to a disturbing trend upward. The 7-day average number of patients increased to over 84 on August 28th. Today, there are 76 people hospitalized. 53 of them are from Lancaster County, and 23 are from other communities. 9 are on ventilators, and 4 of those are from Lancaster County. No deaths are reported today, but we did report 3 yesterday, bringing the total number of deaths so far in August to 27. 22 of these individuals were unvaccinated, and 5 were vaccinated. This is the most deaths we've had in 1 month since February. Our COVID-19 risk dial will stay in the mid-orange range this week, indicating that the risk of the virus spreading and the impact on our community is high and continuing to increase. Now I want to share an overview of our local indicators. Nearly all key metrics remain at high levels. Positivity rate, case rate, and deaths are all in the red. The healthcare system capacity remains in elevated orange. The vaccination rate remains in yellow. Contact tracing is in yellow this week, and the average testing turnaround time is on the border of green and yellow. You can see the current position of the risk dial in the mid-orange, represented by the blue square outlined in red on the color-coded chart in the orange area. Now, joining us today to talk about how this surge is affecting patients is Dr. Erin Schmidt from Lincoln Pediatrics. She will also give us an update on her practice vaccination efforts. Welcome, Dr. Schmidt.
Thank you, Pat. Thanks for having me, and thanks for your update as well. I can give you some information about what we're seeing in the pediatric population, as well as the parents of our families, too. We are seeing an increasing numbers over the summer of cases. In June, we had 2 cases. July, we had 9 cases. And so far in August, we've had 53 cases. So we are seeing an increasing number. And it's not just the numbers, but what's happening in the community that makes it very critical. We're hearing about parents from unvaccinated families that are getting sick enough to be in the hospital and causing some devastating outcomes. And I would just like to encourage people to become a part of the solution. And it's wonderful that we have such a great vaccine available. Anybody 12 years of age and older can get the vaccine, and we can help prevent these kinds of scenarios. We, thanks to the health department, working with them, we've been able to provide the vaccine in our clinic as well as every pediatric clinic in town. And here at LPG, we've been giving about 100 doses per week over the summer. And I've heard on some national statistics most recently is that about half of 12 to 17-year-olds have received at least one dose. So I think more parents and teenagers themselves are becoming more interested, and it's great that we have that opportunity to provide that in clinic where people can have a direct conversation with their provider and go over whatever questions they have, and then save them an extra visit, and we could give them a vaccine here in clinic. And that's been very wonderful. As more people are becoming aware, is that the Pfizer vaccine does have full FDA approval. And that's a common question I've heard over the past several months is, how safe is this vaccine? And just questions about that in general. And I think now that we have that full FDA approval for 16 years and older, I think that provides families and patients with more reassurance. And we haven't had any negative outcomes from these vaccines.
Thank you for that information, Dr. Schmidt. I know you have to get back to your patients, and we appreciate you taking time out of your busy schedule to join us today. We also appreciate the partnership with Lincoln Pediatrics and our other pediatric practices. In the community, you should know about 4,600 doses have now been provided through this effort at the pediatrics offices. We're working with the local pediatric practices also and other partners to establish a process to vaccinate children ages 5 through 11 years old when the COVID-19 vaccine is available for them. Vaccination continues to be our best defense against the Delta variant. We strongly urge all those eligible to get vaccinated. Vaccination will help prevent severe illness, hospitalizations, and deaths in our community. More vaccinated individuals who contract COVID-19 are reporting mild symptoms, and some have no symptoms at all. Over the last week, the trend in vaccinations has kept climbing. Nearly 21,000 Lancaster County residents were vaccinated over the past 5 weeks. About 60% were initiating vaccination, and about 40% of those were getting their second dose. Every person vaccinated creates needed protection for our community. It's encouraging to see that every age group, starting with 45, has reached the goal of at least 75% of the population fully vaccinated. Vaccination is available every day at all clinics and at local pharmacies. You can find upcoming vaccination clinics at covid19.lincoln.ne.gov or by calling us at 402-441-8006. You can also find local pharmacies offering vaccinations at vaccines.gov or by texting your zip code to 438-829. We are partnering with CHI St. Elizabeth's and Bryan Health to host third dose clinics for people with weakened immune systems who have already received their 2 doses of Pfizer or Moderna vaccine. The first clinic was held over the weekend, and the second one was earlier today. We're also in the process of readying plans and finalizing locations for booster dose clinics so we can start administering those doses when they become available. Recommendations for the booster doses continue to be discussed at the federal level. We will provide more information as we get closer to the starting this large-scale effort. We do want to remind everyone that the current directed health measure remains in effect through September 30th, and masks must be worn indoors. People, both vaccinated and unvaccinated, to continue to share indoor spaces and crowded outdoor spaces where the aggressive Delta variant can spread. Wearing a mask is a common sense measure that also has a strong impact. We have the tools to stop the spread of the Delta variant. We know what works and the actions we need to take to get us through this surge and back where we want to be. And with that, we'd be happy to take any questions.
Is Dr. Schmidt still on the line?
Yes.
Okay.
Hi, Pat. It's Matt Olberding with the Journal Star.
Hey, Matt, Jared's going to ask Dr. Schmidt a question. Can you hold 1 second?
Sure.
All right, thank you. Yes, Dr. Schmidt, thank you so much. I just wanted to follow up real quick. You had said there was 53 pediatrics cases this month. Can you kind of tell me if those cases were people who were eligible for the vaccine or not for the vaccine?
That's a great question. And I don't have that information on hand right now.
Okay, thank you.
So, Pat, I was just wondering if you have any statistics handy about how many cases recently, or what percentage of cases recently are in the younger age group?
Matt, okay, that's on our dashboard, and I didn't look at that right before I came down here to tell you, but it is on the dashboard in the age grouping that should be.
Okay, is that by week or is that just a cumulative number? I was interested more in recent cases.
In this, we'll get that and send it to you.
Okay, great. And then I just had a clarification question for Dr. Schmitz. Those case numbers that you gave out, those are just patients from Lincoln Pediatric, correct?
Correct. Yes, that doesn't count the entire pediatric community of Lincoln. Correct.
Okay, great. Thank you.
Pat, we now have the cases by age group.
Matt, can you see the cases by age group? They're on the website that they're showing.
I'll have to
Bottom
check
line.
that.
On the bottom one, and we'll follow up with you after this, okay?
Gotcha. Great. Thank you.
And then Health Director, I just have a question for you. You said that there was clinics for booster shots this weekend and another one today. Can you kind of tell me how many people have gotten their booster shot at this point?
Okay, so I'm going to clarify. We were giving third doses, and that's something that's really confusing. For people who have an immune deficiency as identified under those guidelines from CDC, following those recommendations, those are people that have had 2 doses of either Pfizer or Moderna, and they need a third shot to complete their series, unlike people who don't have an immune system. The booster doses are the ones we're waiting for the FDA approval and then the recommendations from ACIP and CDC to give. And we know that they're meeting later in September. And so we're hoping, we've heard this one date out there, and I think it's really confused people because there's no confirmation of that. But boosters are 8 months after you're fully vaccinated, so after your second dose of Pfizer and Moderna. And we will notify people that we provided vaccine for. We're able to follow that, and we'll notify them when it's time for them to come in and get their booster.
So once that is finalized, you will be able to tell people like it's 8 months out, it's time to get
Yes.
that third dose.
Yes, we will be able to do that, and we've already been planning that for the last few weeks and getting everything ready, so we'll be able to respond quickly.
All right, thank you.
Hi, Pat. It's Matt again. I have another question for you. So you talked about how case numbers have kind of stabilized. It looks like hospitalization numbers this week are maybe kind of stabilizing a little bit. Is that encouraging to you, considering we've had, a couple of weeks of, school kids back? We had the university starting last week. And cases are not, they're still going up, but they're not going up as much as they were before. Does that give you any optimism at all?
Yeah, it's encouraging, but it's not enough for us right now seeing this to know that that's really a reflection of what's happening. We're still getting into that time where the university and the school's settling in. So the next couple weeks are going to be really important, and especially now that we're using the masks, that's going to be really helpful for us. I have to say, you know, on Friday, we had 88 patients in our hospitals with COVID. So, you know, it is exciting to look at our number today, but it's just too early to tell if this is really a trend and a pattern change, Matt.
Okay, and then one other question I had, because it's a question I often get from people. Those 5 patients who died who were vaccinated, do you have any other information about those patients? I mean, were they elderly people? Did they have, you know, underlying health conditions that made them more prone to have severe breakthrough cases, that sort of thing?
You know, Matt, from what, just off the top of my head, I know that some of them were elderly and had other underlying conditions. 2 of the other individuals that were younger did have some underlying health conditions as well.
Okay, thank you.
Sure.
And I guess for those people who do hear that even some people with the vaccine are still getting sick and some are dying, I guess, how do you kind of counter that to let them know that the vaccine is still effective, that people should get it?
Well, in looking at it, it's very rare that anybody who's been vaccinated is hospitalized. And sometimes it's people with other severe underlying health conditions that are the ones that we're seeing in the hospital. So for the majority of individuals who've received the vaccine, very few of them are hospitalized. The hospitalization numbers still are really high among unvaccinated individuals, probably close to 90 or 95%.
Thank you.
Mhm. Okay. Thank you. Thank you for joining us today. Please wear your mask and get vaccinated.